WEBCAST is now starting. All attendees are in listen-only mode.
Hi, good afternoon. Today is Friday, May 1st. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. Today we have Bernie Simons, Deputy Secretary for DDA, presenting, and also with us is Patricia Sestoki, Director of Programs, and also Rhonda Workman, Director of Federal Programs from DDA. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options for listening to the webinar, by computer and by phone. And if you have trouble hearing, you can try switching by clicking on the appropriate button on the webinar panel. There is a handout for the webinar, and you can find it in the handout section to the right of your screen. Handouts can also be emailed if you are listening by phone. We will be recording the webinar to post on the DDA website. And questions can be typed in the question box in the webinar panel, but we will get to those at the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon, and I want to thank everybody who was on this webinar again today. This is a series that we've been doing every Friday, and today we are going to talk a little bit more about where we are with the Appendix K updates. We'll talk a little bit about the regional office updates, and then any questions that we have. So again, our highest priority for everybody is health and safety. As we all are concerned about that, we will continue to post our DDA website and information on our constant contact communication about Appendix K, etc. I want to just share with you that next week we'll be hosting a series of webinars because, as I mentioned before, I was concerned about where we are with not just having a formal document approved by Center for Medicare and Medicaid Services, but then what does that operational guidance look like? And so Rhonda Workman will be talking about that a little bit later. But, again, I want to make sure that it's clear. You'll see that there's two different types of topic areas. One is at a glance, and the other is specific guidance. So Rhonda will go a little bit more into that. I do want to remind everybody that the Governor Hogan has a proclamation declaring this Saturday, May 2nd, Healthcare Heroes Day for essential workers who are on the front line. And we know that our direct support professionals are doing extraordinary things during their shifts to ensure that people are safe, healthy, happy, heard, understood, and are clean, etc. And so we know that a lot of people who have been working multiple hours have also been sheltering in place, etc. So again, I want to thank all of you and all the direct care staff and all of the staff of the agencies and people who have been working with individuals who are self-directing and banding together and trying to keep everybody safe and healthy as we can. So I also want to share with you that we had some good news, because DDA got a second delivery this morning of PPE that has already gone out and is at our regional offices, and we will do a distribution following a similar process that we did the last time we got PPE. I can tell you, though, that we've updated the form to be a little more efficient. So that should be going out today if it hasn't gone out already, about what does the form look like, so we're a little more efficient. And that I know we've got some additional supplies, because last time we had gloves and we had face masks. I understand that we got some shields this time, as well as gowns, etc. So again, we'll be looking at that and working with people and getting out the PPE as soon as the requests start coming in. And they all have been delivered. So, I mean, that's the good news. So, regional updates. We know that we've been reporting on this every week, and I wanted to continue to do that so that people get a sense of what the numbers look like with the agencies and individuals and staff, either self-directed micro boards, providers, etc., that the regional offices have been interacting with and receiving updates about where we are. So let's start with the South region. And to date, we have 103 confirmed positive cases. We have 25 negative cases, and we have 27 pending cases, and we have had 7 people pass away. In the East region, we've had 9 confirmed positive, 11 tests were negative, 4 are pending, and we had nobody pass away. In Central region, we've had 45 confirmed cases, 48 negative, 6 pending, and they have had 7 people pass away also. And in the West region, we have 22 positive, 8 positive, 22 negative, 2 pending, and we've had 2 people pass away. Now, those are all people who are in supports and services. So what I want to share with you today is we've also been having discussion and gathering information from our providers about, so now what does staff look like? And this is for DSPs. So to date, people have tested positive. There are 25 staff in the South, 8 in the West, 33 in the East, and 50 in the Central region. And we have had 1 staff pass away. And so I just thought that, instead of just talking about the individuals that we provide supports to, I thought it would be important to add about our direct support professionals, since, they're the frontline people and who we need to get the PPE to, et cetera. And so you can see that it's interesting in looking at this because the East region has 33 staff who have tested positive, but their numbers for people in supports are only 9 that have tested positive. And so I don't know what we can probably make of that. It might be where people might be working with second jobs, now even within our DD providers, et cetera. So I think we'll reserve any comments other than that, but we will look at and continue to evaluate and to share that information. So we'll continue to share everything. We'll continue to collaborate and advocate on behalf of people who support families and staff. And again, I think it's good news that we got another shipment of PPE today that went out to the regional offices. And we need to continue to keep you updated. So before I turn this over to Rhonda, I have past comments on these webinars as well as other venues that I've asked my operations staff, which is fiscal and operations, obviously to deal with the fiscal, the budget, as well as PCIS2, et cetera, and the program staff, who obviously do self-direction, federal programs, et cetera, to work on and create an operational guide. Again, as I said earlier, I'm concerned that the Appendix K that went to CMS for approval basically did not tell you then how to implement. When we talk about retainer days and you have retainer days, that doesn't tell you, so what type of documentation do I need to do, et cetera. And so that was the whole purpose of this operational guidance. As I said last week, we've been working on this for a period of time. We made an assumption that many of the requests that we had in Appendix K to go to CMS would be approved, and I didn't want to wait until the date of the approval came back and then start working on something operational. I think we need to be able to meet the needs of people, and that's what the DDA administration is all about. So we tried to streamline everything as we could to use short forms on a short version and not to have multiple forms, et cetera. I think it's important that we will be doing a webcast next week. I think there's either 3 or 4 dates. Rhonda will be going over that. And the webcast that we're doing, I believe, does not have a limitation like the one we're doing today of 500. I'm sure that either Patricia and or Rhonda can clarify that, but that was my understanding from conversations yesterday. And with that, I'll ask Rhonda Workman to take over this presentation.
Thank you, Bernie. Appreciate that. So let's do a review and have an update related to Appendix K. So since the Appendix K was approved that we shared last week, we have posted initial operational guidance on the DDA webpage. There's a dedicated Appendix K noted here on your screen that you can click and go directly to our guidance and information. Just as a reminder, the Appendix K covers all three of the DDA waiver programs, including our family supports, community supports, and the community pathways waiver, and became effective March 13th, 2020, meaning all the provisions that are in there are available to have started in March 13th and will go for a one-year period through March 12th, 2021. Next slide, please. So as you start to look at some of the information that we have on our website, in addition, we did send out an email blast this morning about 9 o'clock to share with our stakeholders that the information was posted on the webpage so that you could easily access it that way. You're going to see on our dedicated Appendix K webpage the following categories of information. The first is letters, and so that would be the initial correspondence that we had shared with our stakeholders related to Appendix K. Second is the federal application. That's going to include our initial request to CMS. It's going to include the final approved Appendix K from CMS, and it will also have the CMS approval letter. Next, you're going to see a DDA Appendix K provisions at a glance, and that's a quick overview, shortened version of the various provisions that we'll show later in our presentation. The next section is going to include about 20 documents that we're referring to as at-a-glance documents. These are meant to be short informational sheets to help stakeholders know some of the provisions and the highlights from our Appendix K approval. Next, we'll get into topic-specific guidance for Appendix K, things like our retainer payment, things like services that don't require pre-authorization, and our staffing flexibilities. Currently, we have 10 that we'll show in an upcoming slide. And then lastly, we have a section that we will start to put our topic-specific webinars that we'll be conducting next week and in the future under this category so that stakeholders can go back and view the information at any time. Again, on this slide, we have the link to the dedicated page. This slide, slide 8, is showing you a listing of the various Appendix K at-a-glance documents. We looked to provide information in various formats that were either specific to specific service, such as our behavior support services, or community living group home services, or specific to a topic, such as our staffing flexibility, or the retainer payment, or isolation rates. So when you have the opportunity to go on the website, you'll be able to click on these various at-a-glance documents to see the overview of the different services that we have put together. One of the at-a-glance documents relates to information for families. And we asked our Director of Family Supports, Mary Ann Kane-Bresci, to work with our regional advocacy specialist to help develop a at-a-glance page to support information to share with individuals and families. Utilizing our communities of practice tools, you can see that we've categorized some information related to the flexibilities in the Appendix K under our community living, daily living and employment, healthy living, and supports for family. So at a glance, you'll be able to see information quickly. This slide is a slide about rehabilitation. And for day of habilitation, just to kind of give you an overview, majority of our slides, actually all of our at-a-glance slides with the exception of the information for families, will be categorized in this format. You're going to see at the top left, under the Maryland Department of Health logo, the icon associated with COVID-19. That's going to help to be an indicator that the fact sheet is specific to COVID-19. The specific topic name, such as day have, is noted at the top right. And then within the fact sheets or the at-a-glance sheet, we'll have categories such as information related to service delivery flexibilities, staffing flexibilities, service authorization flexibilities, and retainer payments and billing if it applies. Next slide, please. This slide is an example of our community living group home at a glance. And so you can see it shares the same format in terms of those different categories. In this slide, I just wanted to additionally point out that at the bottom of each of the sheets is easy accessible links to our Appendix K page for which you can easily access. In addition, we have included our dedicated email address for questions related to Appendix K. That's at dda.toolkitinfo@maryland.gov. And in addition, as you see at the bottom right-hand corner, there is a issue date that it will be associated with each of the at-a-glance. There will be an effective date, all of which will be the March 13, 2020, and a version date. As we move forward and go through additional guidance, we look at our frequently asked questions, there may be some updates to our forms, our guidance, and these at-a-glance tools for which we want to make sure that we can indicate that the date of that as a reference for you. Next slide, please. So in terms of our topic-specific guidance, looking at our Appendix K, we prioritized information to put together and share with you. And so when you go on the website, and in this presentation, you're able to click on these different links, it's going to take you to our topic-specific guidance. We have one specifically related to retainer payment. The second one relates to residential daytime shared service hours authorization. Our third offer exceptions that are available under that service. Number 4 is related to exceptions to our pre-authorization and other service requirements. The exceptions to pre-authorization includes information related to our behavior support services, our nursing services, in addition to the additional respite services that are allocated. Number 5 relates to our new service authorization request process. As per directed by the Deputy Secretary, we wanted to streamline the process in terms of requesting new services based on health and safety needs and not utilize our legacy modified service funding plan process. Number 6 relates to staff training and onboarding flexibilities. It includes a variety of information to include the use of family members and legally responsible individuals, in addition to amended training requirements and quicker onboarding flexibility. Number 8 will give you information related to service delivery and alternative settings. That includes the ability to provide residential services in other settings or sites, provide services in acute care hospitals or short-term institutional stays, in addition to the ability to provide services out of the state of Maryland and our neighboring states. Number 9 relates to site capacity and the ability for our licensed providers, particularly our residential, to exceed their license maximum. And so you'll see information related to those options and the way that we would like you to notify us. And number 10 relates to exceeding group size, meeting our community development services, and also a process for providers to request approval from the DDA for exceptions related to 2-to-1 and 1-to-1 staffing. In terms of the memorandums or those topic-specific guidance, we have formatted them all in the standard way. Initially, you're going to see background information, which is standard across them all. There'll be a brief overview of that topic and an at-a-glance chart to indicate what services are applicable. Then you're going to see specific standards and requirements, information related to fiscal and billing processes, and then links to applicable resources. This is an example of our guidance number 1 related to retainer payments. As you can see, the background information is noted. We have a brief description of the overview, and then the information on the right gives you that at a glance of the services that are applicable. This guidance includes a few additional pages that gets into the details of the standards and requirements that will go into further detail in our webinars next week, in addition to the billing processes that are related to PCIS2, the pilot providers, or also self-directed services. And finally, in this guidance, we also added some information related to any fiscal reporting requirements that may be related to this specific topic. In addition to, we provided an at-a-glance chart to help visualize the different retainer payment options. In terms of forms that we have created to streamline information, whether it's a request for a new service or notification to the DDA about services being provided in alternative sites or out of the state, we've come up with some short, condensed, streamlined forms that we have designated specific form numbers. So the first one relates to a new short service authorization form. It's referred to as DDA COVID Form number 1. That form will be used to request access to additional add-on services and assistive technology, in addition to alerting us to the need for behavior support services, nursing services, and respite services without pre-authorization. The second form, DDA COVID Form number 2, is a form that will be used to notify the DDA about the site location of services. It does not require approval, it's just a notification. The third one is the staff ratio exception form, form number 3, which will be used to request the exception for the 2-to-1 and 1-to-1 request. Form number 4 will be used by the DDA to the LTSS client attachments so that we don't have to go through a full, yes.
Can you repeat number 4, you and blank?
Yes, I'm sorry. Form number 4 will be utilized by the DDA. This form will be used for us to indicate new services that are authorized as a result of COVID-19, and we will upload this form into LTSS under the client so that we don't have to go through a full revised PCP process. Lastly, the cost sheet, there's the opportunity to request new services or additional meaningful day services using this form without having to go through a full modified service funding plan process or associated forms. Can you go to the next slide, please? So the next few slides are examples of the forms that we just talked about. So this is the example of that service authorization form. You'll see the provider will have the ability to put multiple people on one form, and the first section of it relates to just indicating whether nursing services or BSS a yes. It's followed by the respite services to note whether it's daily respite or hourly respite services that are being requested. The next section moving to your right is an opportunity to request additional add-on services for people currently authorized for community living group home, supported living, or personal support by indicating the start and end dates, and also an opportunity to quickly request services or funding associated with assistive technology. In this request, we're only asking for some minimal information related to what is the need for which these service requests are trying to address, what is the risk, and has the requested services mitigation being addressed. In that, we're also asking that you indicate the date of approval from the participant who has agreed for these additional services. And then lastly, on the far right, the regional office director will indicate their decision and any notes with that. In this form, you'll see that we also have instructions to help guide, noted at the top, and under the word instructions, we've noted a create date so that you can reference any revisions to the forms. The forms will be uploaded on the DDA website over the weekend or by Monday morning. Next slide, please.
Can you talk about the bottom left of the form, please?
Sure, absolutely. So the bottom left of the form includes the DDA Regional Office Director's signature and date. Again, their decisions related to each person and the request will be noted on the right column, the right side under Regional Office Review, but they will sign and date this form and they will send it back to the provider who sent it. The second form, form number 2, is that site notification form. And so it's going to be used, as noted in the instructions, for community living, supported living, personal support, CDS, and day hab if they're providing services in acute care hospital or short-term institutional stay, used by our community living and supported living if they're providing services in an alternative site, and used by the community living group home if they're going to exceed their site capacity. Again, the opportunity for the provider to list multiple people on one form that would be submitted to the DDA regional office in a dedicated email account and indicate the information that is applicable to that person. This is not a form that for which the DDA will be approving or authorizing. This is simply a notification to the DDA. Next slide, please. The third form for providers to use relates to the staff ratio exception. And for this form, it will require the DDA Regional Office Director's approval. Providers will enter information for one person that is specific to their needs that have been authorized currently 1-to-1 or 2-to-1 support. The provider will indicate the new proposed staffing ratio, any additional comments, and then just put some information related to how the need currently being met and why that is unattainable, and what the risk is if the needs cannot be met. The regional director will be reviewing the information submitted from the provider, who will have the agency director's name and signature and date, and the regional director will make a determination, approve, deny, or may pend the decision requesting additional information from the provider. This form then will be sent back to the provider so that they would have the DDA decision, and it will also be uploaded into the client attachment section. And then lastly, we wanted to again let you know that we have revised the cost detail sheet. So this is the current view of the cost detail sheet. You're going to find in the new revised one, we have updated our instructions related to how it will be used during this process for the emergency of COVID-19. And so you'll have the opportunity to use this solely and not have to use the full modified service funding plan process. Next slide, please. Can you go back one slide, please? Thank you. The change or the revision for this for the revised cost detail sheet is really going to be found on the second tab. You're going to see it's labeled justification. And again, mirroring that simplified request form that we just showed, the provider will only need to indicate what the need is under the justification questions, what the risk is with a few sentences, how the service requested will mitigate that risk, and then indicating that agreement with the participant related to these additional services. The DDA regional office will indicate their decision and approval or request additional information in order to make their decision. And so for the revised cost detail sheet, really the revision is related to this new additional tab under justification for you to indicate this information. Next slide, please. As you'll see, the following tabs are exactly the same as providers currently use in terms of the cost detail sheet. It'll include the different services with the drop-down options and the opportunity to use the personal support tool to calculate additional hours and the add-on tool. So the providers being familiar with that can continue to use that existing tool. So now let's talk about next week and kind of some of the next steps. So we posted information on the website, and we want to be able to provide topic-specific webinars to go into additional details and also to have an open dialogue with questions from you. So the DDA is hosting a series of webinars next week. They will occur from 10 to 11:30, and they will be conducted Tuesday, Wednesday, and Thursday. On Tuesday, we will go over the following topics: retainer payments, residential daytime shared service hours, personal support authorization and exceptions, and increased rates for supporting persons with the virus. On Wednesday, we will review information related to the exceptions to the pre-authorization of services and service requirements. We'll talk about that new service authorization request process and that new form we just discussed, including the revised cost detail sheet. In addition, we'll be sharing information related to self-direction provisions. On Thursday, we'll talk about staff training and onboarding. We'll talk about service delivery in alternative settings and out of the state of Maryland. We'll discuss the site capacity and review those forms we talked about. And we'll also talk about the process and standards to exceed group size and to request that exception to staff ratios. This is our new at a glance of the provisions of Appendix K. And so we wanted to provide an opportunity to visualize the different options that are highlighted related to the provisions, which is noted on your left column, and then across the top as it related to either pre-authorization or a specific service, such as our community living, our behavior support services, and such. To the far right, we also added a data column related to self-direction. So we're hoping that this will help stakeholders in terms of another visual way to look at different options and provisions that are available under the Appendix K that has been approved. This is also noted on our Appendix K webpage that you can easily access. So to kind of wrap up for today, some reminders for you is we are asking that you carefully read the resources posted on the DDA's Appendix K webpage. That'll include the at-a-glance documents, the topic-specific guidance memorandum, and we'll also be posting frequently asked questions that were submitted last week and through this week into that dedicated email account. We hope to have that up soon. We want to remind you and encourage you to register for those webinars. That registration was included in the notice that went out today, and we're happy to share that with anybody who may not have received that. And again, we encourage you, after you have reviewed this information, to submit questions that are not addressed in the guidance or the frequently asked questions to that DDA dedicated email account so that we can use that to help frame the information that we can share and discuss next week in our webinars. I guess lastly, a couple things that I would share. Yes.
So I just open it up for questions, and what I want to tell folks is that next week, the way that we want to be able to carry out the presentations will be more interactive, so that after we go over each section and Valerie, Roddy, and Rhonda discuss information about billing and program operations and the forms, would open it up the mic for specific questions and answers so that we can dialogue and have some really good conversation for each of the topics that we'll be discussing. So Rhonda, I'm going to read some questions as we go through this, and you can add what you were going to say.
Okay, great. Yep. So I was just going to say that.
What?
Go ahead.
Go ahead.
I was just going to add before we go into the questions and answers that we'll be posting additional information and updates to our website to include information for self-direction. So look for that over the weekend. And we look forward to discussing with you next week.
Okay, so what should day program providers do if residential providers doesn't allow the individual to participate in distance learning? What resources does the day providers have to obtain funding?
So that's a great question. I think first we all need to utilize our person-centered principles and strategies to really talk about at this current time what's the best services and supports for the individual, which could include those supports for their meaningful day provider. A reminder that our meaningful day services can be provided remotely, and so therefore the actual staff does not need to go into the residential site, but can provide services and support telephonically and through other means. If there are some concerns related to not having those opportunities, we encourage the team to get together and further discuss the best services and supports for the person at that time. And if you need additional information, you can reach out to our regional offices if we can be of assistance.
What other waiver services is the support worker allowed to work for?
In Appendix K, we included the opportunity for support brokers to provide other services. It was not limited to any specific service, so support brokers can provide any of the self-directed services. However, please note that the rate for reimbursement will be based on the reasonable and customary range for that specific service. The support broker would not be reimbursed under the support broker rate.
Is the 18 retainer days, is it per person or for the program as a whole?
The 18 retainer days would be related to the specific service.
This one is hiring family. Do we have to do the background checks and MBA checks? And what happens if an accident while they are on the clock?
So under the staff flexibility and onboarding guidance as approved by the federal government in our Appendix K, there is the ability for family members and legally responsible people to provide services. In those events, the provider would be hiring the staff, or the participant self-directing would hire that person as staff, and they will need to complete a modified version of criminal background checks and the MVA check.
So the next one is for doing remote day services. Does it have to be live or can it be recorded and people watch it later? No, it has to be live, it has to be interactive, and it has to be we're doing some type of interaction with that person. Will there be a relief for residential programs who are providing unfunded services for individuals who are typically at a program?
So under our guidance number 2, we are authorizing.
Valerie, do you want to answer that? Go ahead, Valerie.
Okay, well, if Rhonda was sorry, I'm sorry, I didn't mean to cut her off. The short answer is yes. We are adding additional hours to cover what a person would normally be at a day program, recognizing that the residential providers having to add those hours that are not typically provided during a normal Monday through Friday scenario. So there is, again, this is also addressed in the guidance, and it's detailed because depending on the service, there were things that we were able to do so that it's done on the back end, so the providers didn't need, or the CCSS needed to do anything to trigger these additional hours. And I would just recommend, because there is a lot of detail in the guidance, that I would reference that information.
Thank you, Valerie. Please clarify the protocol to request PPE from the regional offices. So it's the same process that we did last time. We're just making sure that it's a little more clear and streamlined for people to be able to get the PPE from the regional offices. And you should be getting an email from the regional offices today so that you can request whatever you need for your agency. When can we expect to receive the new PPE order form, which I just gave you the answer to? Can the DDA break down the COVID incident data by traditional and residential, traditional and direction? We can. We haven't done it because we don't have a lot of people in subdirections who've been COVID positive have been reported. Okay. So what is the rate we can use to project for additional share staffing in residential during the day?
Okay, so the payments will be made based on current rates. So we use the current add-on rates to cover the additional hours that need to be provided.
Okay. The next one is our local health department has told our nurse we have to test every staff and person served based on the 420 executive order. Can anyone confirm this? That executive order at the moment does not apply to the DDA residential sites. So for our DDA program at the present time. It would be great if you could archive the webinar next week so that people can access them at other times. That's a great question. Archive every webinar that we do. It's also posted on the website under Appendix K, and you'll see every Friday that the Deputy Secretary has done. And we'll do the same thing with this webinars under Appendix K as Rhonda illustrated during her presentation. I'm just going through some of the questions. Some of them are repetitious. Some folks are just saying that some of the information is very easy to read. They've gone through the website, looking at the documents, and appreciate the clarity and the rapidness and how we've sent the information. Day programs have been closed for 35 days without guidance regarding distance learning options. What programs, service, and funding for past days, while Appendix K goes back to March 13, have no way to know what to do before now that we could provide supports and funded? That's a great question. The DDA has been providing information on the website, different resources from different local and national organizations on distance learning. Some programs have taken advantage of doing that option, some have not. And I think that look at the guidance, a lot of opportunities and flexibilities for providers to be able to get paid for services that they have rendered. Valerie, would you like to add anything to that, or Rhonda?
No, I would, again, emphasize that one, we have extended the deadline for inputting March attendance until the end of May, so that the providers could take advantage of the changes allowed through the approval of Appendix K. And again, to reiterate what Patricia said, there's been other guidance that has been provided relative to other alternatives.
Some of this is very specific to the webinars that we're going to do next week. So I'm going to ask folks to join us to read some of those the questions, because I think we'll be answering them as we go through the presentations next week. I'm just reading. Retainer payments for personal support, 7 hours, page 3, and 7 hours on page 5.
Thank you for letting us know that. We apologize for the conflict of information. We'll go back and review that and make sure it's consistent. And again, that's where, as we update this information, when we repost it, we will indicate the date associated with that, so that you'll know that a new version was posted.
Yeah.
So our FMS have said that they have now received the letter and information posted on the DDA website. When will the FMS be given the information? That's a great question. We actually put out all the information for everyone at the same time, and we also posted on Facebook. We will be doing next Wednesday a webinar specifically to self-direction and the guidance that we go through that in detail, and everyone was going to get it at the same time, the FMS, people in self-direction, and families. What is projected turnaround time? Will weekly checks in a nuisance? And I guess it depends what turnaround time on what, on the forms, applications, submissions, approvals, billing. So we'll talk a little bit about that next week as we get the webinars, because I'm not sure specifically to what turnaround time you're speaking of. The goal for us at DDA is, in the way we streamline everything, is that we wouldn't have to sit there and do an authorization for each person, but give more empowerment to the provider and the person's team and family to identify what some of those needs are, and you can complete them all at once. So we're hoping the authorizations happen as quickly as possible. We're also looking at what the case management and how they know what's new or what services prize. This is how the DDA is uploaded into the client attachments and the LTSS, so that everybody is, we're trying to figure out a way to minimize the amount of work and administrative work that anybody will have to do, from the providers, from the case managers, from the DDA, everyone, so that if you need a service, you need a request, we minimized it as opposed to doing 10 or 15 different forms. We broke it down into basic or specific forms. I'll have a specific action. Rhonda, Valerie, would like to add anything to that?
I have nothing to add, Patricia.
Yeah, me either.
What is an example of when someone would move from a one-to-one support to something else with a higher ratio? What do you see as a typical scenario?
I think that's a great question, and we don't have any typical scenarios. These requests really need to be person specific. So what we were thinking, there may be a residential site that's providing one-to-one for a person, and maybe based on changes in the activities or current status of the circumstances in the individual, that they may be able to provide services in a 1-to-2 ratio instead of the 1-to-1. And so we wanted to be able to provide that option if the provider felt that they could still meet the person's health and safety by providing services in a 1-to-2, 1 staff to 2 participants versus the 1-to-1 ratio, that they could make that request. But again, it is not a standard. It would be person specific and would require the DDA regional director's approval.
So, Rhonda, if the regional office have already been told that ratios regarding 1-to-1 is happening in certain situations already, waiting for approval is not appropriate unless it can be done immediately. Is there anything you'd like to comment on that?
All I could say is that, you know, we're working on this information and guidance and process. The forms could be submitted to the dedicated email accounts, and the regional directors will be viewing that and working through that as fast as they can.
So let me explain a little more about this piece. This is for people who either need 1-on-1 or 2-on-1 or 2-on-1 who are not getting it, and 1-on-1 who may not be getting it. We understand the lack of staff. We understand the strength that the system is on. So what we want to do is we understand that there's flexibility that we put out, that if you can't provide the appropriate ratio for staffing, to know and how you ensure health and safety of that person, and not only of that person, but also of your staff. So it's mainly the communication back and forth. And if you need additional approval for a 1-on-1 or 2-on-1, what would constitute that and how you submit that request? Will regional directors be backdating the approval of the ratio change? And when do you have when you have to change the ratio, do the staffing is or something we have time to approve for that first?
So that's a great question. From my perspective, the regional director can approve that on a backdate perspective, provided that the provider has signed and attested that it's meeting the person's. But we'll take that back and look at that internally and share that with the next webinar.
Anna, can you talk a little bit about self-direction? This caller is asking, will self-direction families or participants be using the same forms or different forms?
So that's a great question. We are proposing one new form associated with self-direction that we'll be sharing in our guidance that we'll post and in our webinar next week. This form will allow the person to move funding among their existing services within their budget without any DDA or regional office approval. It'll also provide the opportunity for people to request the use of that new additional $2,000 that has been allocated to support increased support broker hours, increased service hours, an increase in staff recruitment, or for costs associated with PPE. In terms of any additional service requests, you would utilize that service authorization form or the revised cost detail sheet.
Hey, Marie, can you answer this one? We have already certified March attendance. Now need to have the opportunity to make changes based on Appendix K, recertify. Will we be able to do this?
Yes. The short answer is yes. If you have already certified your March attendance, but now obviously want to take the opportunity to revise it, you can go in and revise it because the system has not yet been locked down because, again, we extended the deadline. So you can make the revisions and recertify the attendance.
Thank you, Valerie. Through this, I know we have a few more minutes, and I'm just trying to pick the ones that are they're not repetitious. Why wouldn't PPE be approved for employment since we are supporting 33 people in the community who are working? We are providing PPE for job coaches and people. I'm not sure if we're providing PPE. If your residential program is serving people and you have day program staff work in the residential, then you should be able to get the PPE. But if your day program is closed and you're not open, then we're not distributing PPE to the day program. So work with your region, let them know your situation, and then request accordingly. They will work with you based on the people that you have working at specific sites. Hey, Valerie, will there be additional coding in PCIs2 for attendance for residential? If yes, when will this begin?
So the answer is yes. We did touch on this in the guidance, and it is ready and it has already been deployed.
Okay, I'm going to do 3 more questions, and then we will end our webinar. Some of them about the certified billing already. And then what will the participant capacity be for the webinar this week? Great question. So Bernie, our Deputy Secretary, had talked about that we were going to change the platform. Let me explain this to the caller today. We've only been able to accept 500 people here because we had 10% of the people who participated use a phone line. And so what happens is when you use a phone line, you either have to choose by using a phone line or using a whole website platform. By moving this to a webcast, we would then expect everybody calling who's going to participate to join us on the internet through a webcast, and then we can open it up to 6,000 people. So the goal will be that we'll do this actual training next week. Is going to be a webcast, and then we can have more participants participate. People would not be able to call in, but you can use your smartphone to register and be able to access the application through your smartphone. When will payment for day service for enterprise begin?
Patricia, could you repeat that? I couldn't hear all of the question.
When will payments for day service for resident providers begin?
So the payment is the same timing as it has been in the past. Providers, it's on the same schedule. There is no different schedule. And the payments will be captured as we collect all the information and process each of the quarterly payments. Now, unless they mean when it becomes effective, and again, all of this becomes effective March the 13th. So, but otherwise, the payment will be processed as it normally is.
Okay, this is my last question. I'm reading Appendix K, effective date is March 13th. However, since some of the guidance came out this week, families who have been providing the supports for the last month were not documented, nor do we have a formal documentation that were trained in PCP behavior supports. Are we able to bill as of the effective date for families who provided the services, or do we need to begin now going forward? Amanda, can you answer that one?
So that's a great question. You'll see in the staff training and onboarding flexibilities that there is the ability to waive some of the training requirements for family members, such as the PCP and behavior plans. So you'll want to refer to that. You're going to need to know what service was provided. So you're going to need some information, some basic information about what was provided. But providing you have that and meet those standards, then yes, you could bill for those dates.
Thank you. What I do want to tell the audience, attendees in today's webinar, is that your questions are very important to us. We actually always get the questions and turn them and put them into our frequently asked questions toolkit that we're going to be posted in our website next week. Please look for your question and answer in those the opportunity. I also want to be able to talk a little bit about self-direction. And for self-direction, we actually are authorizing the agencies to authorize services for people without having to go through a bunch of processes. We did meet with the FMSs about 4 or 5 weeks ago, brainstorm, talk about it. We had Dr. Smalls and Natoya, who are leading self-direction, and they come up with a specific form and processes that we are going to be sharing. We're trying to find it today and this weekend, and we're definitely going to post it and share it prior to the presentation next week. I know that that's been a lot of questions on this chat today, and I just did not want to ignore it and let you guys know. And with that, it is 2 o'clock, and thank you so much. And we're hoping to post everything for self-direction this weekend on the website. So have a blessed weekend. Thank you.